Hello, my name is Monte, and I'm with Wayne Bucklar today, and we're doing another podcast of AI WTF, which is wisdom, technology, and friendship. Not what you would have thought it was. Wayne is also has a health professional radio, which has tens of thousands of subscribers and has been operating for well over a decade, and has lots of content on the internet. In voice and in text and in videos, and occasionally he uses Preserver as a front end. But what I'm really more interested in is him telling you how he uses AI, and with or without Preserver, as a front end for his health professional radio industry and case studies.
Monty, thank you for that fairly flattering introduction. It is true that once upon a time I was a registered nurse, but I haven't worked in a hospital for 40 years or something, a long time. But I also worked in the health department in Australia, in the admin side of things, looking at computers and such like. And I started health professional radio because of that interest in health. And back when I started it, the idea of online radio or podcasting was pretty new and innovative, and we've been doing it since then. And with that in mind, folks, let me put a little plug in. If you're involved in the industry and you'd like to appear on Health Professional Radio, do get in touch with me. We do interviews like this, where I'm the one interviewing you and talking about anything that's relative to health professionals and often of interest to patients. But today I wanted to talk a little bit about one of the problems that I think is emerging in the health industry, which is the increasing amount of admin and record keeping that's required to comply with HIPAA, if you're in that sort of area, or just with record keeping and electronic record keeping, or if you're a mobile health professional, just with providing the evidence of where you were and what you did and how you got there. Now, the tool that I'm talking about is Preserver. It's an app. It's free. You install it on either your Android or your Google phone, and it just brings together all of the things that you might want to keep. So it records your date and time and your place, and it brings up a map, and so if you're moving, it will trace all that stuff. You can also put in voice notes and video notes. But I think this is the easiest way to create a record at a personal level of what you're doing and what you did. If you've got to keep, if you're visiting someone and you've got to keep clinical notes, it is a highly confidential and private app in that it doesn't even know who you are. It stores everything on your phone. It doesn't send it anywhere else unless you tell it to. It doesn't upload it to any AI system or anything that would be seen as compromising patient confidentiality. It's just on your phone. And then if you need to transcribe that into other systems later, when you're back in your office or whatever, it serves as a memory aid. Or at an enterprise level, if you've got a bunch of clinicians working for you who are traveling around doing in-home support or moving, it's a way for them to report where they are, when they turned up, when they left, and it provides a record for that. And they can upload all of that then to either your drive in the sky or to their drive in the sky. In my outsourcing business, we use it for work from home staff so that we know they're actually at home and working, because the way it's time-stamped and the way it's uploaded makes it difficult, not impossible, but difficult to tamper with. So we just wanted to spend a few minutes today talking about that. AI is, sorry, Monty, go on.
I just want to expand, Wayne. In the past I was called the Google Guru, and I did a lot of work with AdWords and SEO. And in the early days, you could get a document from Google which would help you improve your visibility on the internet, and it was called EAT. And that was, are you an expert? Is the information authoritative? And is it trustworthy? And if you had those three, you won. Well, Google changed that. They added an extra E. And they did that because with AI today, I can clone virtually any website in the world and use all their information to appear to be an expert, appear to be authoritative, and appear to be trustworthy. And Google said, we need to add another letter here. And they did, and it was E. And the E stood for evidence. So they want evidence. And what you're talking about, whether it's your remote staff or something else, is evidence. So that being an expert, authoritative, and trustworthy isn't good enough now. Evidence. And evidence can come in the form of testimonials, but it can also come in the form of date and time stamps that where you were when you said you were and what you were doing is accurately recorded. And that's what you have applied to in the health industry and with HIPAA requirements and the privacy and all of that as well. So sorry to interrupt you, Wayne.
That's quite all right. Whether you are working in a major facility, you're part of one of 10,000 staff at a major hospital, or you're working in a private clinic, or you're running a private clinic, or you're just managing your life as a sole practitioner. One of the things that is coming for you is AI. Whether it turns up as a great big helper or whether it turns up as a great big threat is pretty much up to you. But be aware that now something like 60% of people who go to Google to do a search don't ever visit a website, any website. They just type in their query and they get a reply from the Google AI. So how do you get yourself included in that Google AI? It's called answer engine optimization, and it'll be the topic of a whole nother video, but it's something you should be getting interested in if you're running anything in the health industry. And, as I said at the beginning, I used to be a nurse. One of my learnings from those days was that something brown is going to happen to me today. And I don't need to go into what that brown thing's going to be for any of you people. You work in the health industry, you know that brown events happen. However, I can't see AI replacing any of you when those brown events are involved until Elon Musk's humanoid robots come along and are trusted enough to start doing health tasks. But I think that's going to happen certainly within our lifetimes. And given that Monte and I are both old, that may not be as long as yours, but yeah, it's coming as well. So understanding the AI, being able to use it, and being able to establish it as an augmentation to your health practice is a really important thing to be looking at right now. So if we piqued your interest, if you'd like to know more, please reach out. This will be broadcast on a lot of social media channels. So on whatever you're watching, like, follow, subscribe, click all the buttons you can click. We appreciate your feedback. If you leave a message on any of those channels, we'll get back to you. We read all the messages. We don't always get back to all of them, but we try. And you can always reach out to us with the contact details that are on the channel you're watching now. As I said it during the interview, if any of you would like to be interviewed to appear on Health Professional Radio, please reach out. We'd love to have you on.
That's great, Wayne. Thanks for that overview. And I hope people do reach out to you, because Health Professional Radio has been going for decades and the volume of material is substantive. And it covers everything from less than evidence-based, anecdotal type information, all the way to stuff that's peer-reviewed. So there's lots of content for people to enjoy.